Hello and welcome back to Yashoda online segment Know Your Doctor session. Catching raindrops on your tongue, jumping over the puddles, and the adventure of wading in knee-deep water and few extra school holidays. Well, this is what kids wait for when the academic year begins with the onset of monsoon. Monsoon diseases are one of the major concerns plaguing parents when it comes to their wards during the season. So let's discuss about monsoon illness and its preventive measures in our today's episode. I'm Dr. Lakshmi and let's welcome Dr. D. Ramesh, Senior Consultant from Yashoda Hospitals, Secunderabad. Welcome, Doctor.
Hello everybody. I'm Dr. Ramesh, Head of Department of Pediatrics and Neonatology, Yashoda Hospitals, Secunderabad. Today I'll be talking to about some precautions for the young mothers which you have to take for your little babies during the monsoon season, especially the ones below 5 years.
So doctor, with 4 decades of clinical experience in the field of pediatrics, how is this season different when it comes to clinical practice?
Basically, all children have a long summer holidays. They have a summer holidays of about 2 months in which the child is totally rested, totally protected and heavily pampered. The child has a lot of time to sleep. The child has a lot of time to eat. So they are not exposed anywhere, especially due to this, in these times of COVID. We are not making these trips also during summer. So the child is really completely immunologically better. Suddenly the child wakes up to a rude shock when the schools start in June. The climate suddenly from 40 degrees comes to 30 degrees. The climate is completely damp and there are a lot of viruses and bacteria around. And the child has less sleep because he has to get up early in the morning at 7 o'clock and get up less time to eat. So all this causes some amount of tension in the child and leads to infections. So basically we'll divide these problems in the children which they face during monsoon into 3 categories. One problem is due to the air, one problem is due to the water, and the final problem is due to vectors, which are flies and mosquitoes.
So doctor, what are the general problems we encounter in children during the season and why is that monsoon leads to many diseases, especially in children?
Normally during the rainy months, as I was telling you, the problems will broadly, I think, categorize into 3 parts. We'll first talk about the problems due to the air. As you know, till now, the air was very dry, the air was very hot. Now suddenly the temperatures come down to around 30, 28 degrees. The air is very damp with a humidity of almost 80 to 90, sometimes 100% humidity. And not only the humidity and the damp air is sometimes laced with bacteria or virus if the child is in some confined rooms like the overcrowded school rooms which we have now in 90% of the schools, or the child is taken out to a mall or a function hall. Somebody has a little virus or something which coughed over there, and because of air conditioning the virus will not get out from the room. So this is the basic problem with air. So the basic infections which you can get with a bad air is the virus, the bacteria, and not only that, all children below 5 years, it's called the lymphoid age. They have 2 big areas of lymphatic tissue, one in the nose called the adenoids and the other in the throat called the tonsils. This damp air generally expands this and the child will not be able to sleep properly in the night. And if by chance the air has any virus or bacteria, these adenoids, this lymphatic tissue, they expand them and it goes into an infection. And sometimes if the infection is not controlled initially by not going to a doctor early or due to self-treatment, it may go into pneumonia. So nowadays, you know, every season, especially in the rainy season, we have bad infections. Last 3 years we had COVID. And before that, last 2-3 years, we had a thing called swine flu. So some virus the world is getting affected with, which gets aggravated in rainy season because of the dampness. And next we'll go to the water. Water, because the heavy rains and the water collecting in the reservoirs, the water comes down the hills and collects in the reservoirs. And because of this open defecation problem in our country, the water is generally contaminated and it could have plenty of bad infections like gastroenteritis, cholera, typhoid, and jaundice. All these 4 are very rampant during the rainy season if the water is not boiled and given to the babies below 5 years. And finally, the vectors. They can be flies or mosquitoes. Flies generally, more commonly not so, I would say, in our houses. In our houses also sometimes you have flies. You must be very careful that the flies are not there either in the kitchen or in the dining room where the child is eating. And the flies are more dangerous if they are in restaurants or in bakeries where we generally have a habit of getting some outside food and giving to the children. And the most and most dangerous among all is the mosquitoes. Mosquitoes, I would say, the mosquito bites for children will divide into two things. The mosquito bites in the night, which can cause malaria, filariasis, and the very dangerous thing which come in sporadic episodes. We had about 15 years back, and recently the state of Uttar Pradesh had about last year. It's a disease called encephalitis. It's commonly in layman's term called brain fever, especially if you have any pigs around. And the afternoon mosquitoes, which are more dangerous because children are there generally in schools in the afternoon, is the dengue fever. Every season during the rainy months, we lose so many children because of this dengue.
So, doctor, it's common for most of the parents to treat the kids at home with general symptoms like cold and cough for a couple of days. So, when do you think they should seek immediate doctor's opinion for children?
It depends on the season, ma'am. For example, I was just telling you about all the types of illnesses we can get during the rainy months. For example, a child is totally protected and they're at home in the summer holidays. So if he has a little fever, we can think of exhaustion fever for a day, and now the mothers are so smart, they are half doctors. So they know about how to give a little crocin or a little antihistamine for cold. So they can watch up 1 or 2 days because the child is not exposed anywhere. But during the rainy months, when the child is going to school, even after 1 day of fever also, you should not take a chance with the fever. Even after 1 day fever, once say anything, it may be dengue or it may be a simple COVID fever. If it goes beyond 1 or 2 days, then the symptoms will become more, and a simple treatment will become more complicated, and sometimes the child may have to go into an admission also. Even gastroenteritis. The initial phase when the motions are 3 or 4, it's okay. But once they go into explosive diarrhea, and they were saying the child again has to get admitted and go for loose motion. So the child has to go and see the local pediatrician and probably get some few investigations and checks done to make a proper diagnosis.
So doctor, now with the COVID cases on surge, how do you think the presentation of these illness is going to differ in children?
As you must be, recently there are a lot of articles which are published from England and from Denmark about this long COVID in children. COVID, the problem, what is happening is all the adults, all the old people, all the young adults and all about 12 years, they are double vaccinated, triple vaccinated, and some people have taken even 4 vaccines now. So the COVID is not able to do anything with them, and now going to the kids who are not vaccinated. So COVID in children, generally 95% of them, there is no problem. But the other 5%, it can go into a phase called long COVID, where for 2 months the child keeps on getting on and off respiratory infections or having severe weakness, getting body pains, becoming very cranky. So COVID is not something which you lie low, and few of them, they develop this multi-organ system inflammatory syndrome, which is a little more dangerous than where they may sometimes have to be given steroids. So COVID is not, even if it's positive, you have to go and consult the doctor and get some more checks done, whether the COVID is going to just disappear without any complication or may go into a long COVID or a MISC.
So in general, what are the preventive or precautionary measures that parents can take to protect their children from this monsoon illness, doctor?
Now again, because I initially categorized the problems into 3, I would discuss it in the same manner. For example, how to prevent the child from inhaling this damp, dirty, that is polluted air, especially some of the children are not blessed with going to school in a closed bus or a closed car. Some of them may have to go on a 2-wheeler. So these children will be inhaling all the dust which is interspersed with small atoms of carbon monoxide, that's called smog. So this damp air with smog and the damp air with a lot of bacteria and viruses, the only precaution for them is by wearing a mask. Don't use a surgical mask or a N95 mask for a child. A little thicker, very comfortable cloth mask should be fine, because not only it filters the air, it filters the dust, and even the air also becomes a little warm while taking inside. And now going to the water, the only precaution for preventing waterborne disease is by boiling the water. No other way. Don't believe your candle filter. Candle filters, what happens is they are okay for the first 2-3 months. After 2-3 months, you have to wash or you have to sterilize the candle, you open it and again you fix it with a bolt. What happens is when you are fixing it after the second or third time, 2 or 3 drops of water, they trickle down from the bolt, not through the candle filter, and that's a waste of the water is going to have the bacteria or virus. So boiling the water keeps your little baby 100% safe. And finally, you have to be very careful with flies by mopping your floor with some phenyl or something. And the flies in the restaurants and in the bakeries, you cannot go and mop their floors. So the only thing is you are not going to get that food from there and give your little baby. So these are the basic precautions in which you can keep your child safe. Anyway, nowadays, all mothers, I think all these things you will be doing, all mothers are very, very dynamic, very, very intelligent. So also the fathers. But monsoon is such a season, it's a highly romantic season. So sometimes you, with so much romance in the air, you may ignore your little one. So please and please look after that little baby during the monsoon seasons because it's a very dangerous season. Thank you.
So doctor, talking about preventive measures, what are the vaccinations that one can give to children and at what age group should that be given at?
Normally, as I told you, there are 3 or 4 diseases which are very prevalent in this thing. The waterborne diseases are typhoid and jaundice. Typhoid, we have a vaccine, anti-typhoid vaccine, which goes in the routine schedule. But if your little baby is taking the vaccines from the government schedule, typhoid and hepatitis A, which protects against jaundice, is not given in the government schedule. So we may have to go to a private doctor and take these 2 vaccines. This is a lifetime protection for typhoid and jaundice. The other vaccine which every child should take before the monsoon season is the influenza vaccine. Influenza vaccine prevents majority of the viral infections which your baby is exposed to during the viral disease, and the H1N1 virus which causes swine flu, which is quite a dangerous virus because it causes very severe pneumonia and sometimes may kill the child. And also from last 2-3 years, we are getting the H3N2 virus also, which causes a disease called the chicken flu. So this also is prevented by the influenza vaccine.
So thank you, doctor. It was wonderful talking to you.
Thank you so much, Lakshmi. It was some nice questions from you.
So this brings us to the end of this episode. We've been discussing about monsoon illness and its preventive measures in children. Hope it was informative and do join us for the next week as well. Thank you and stay safe.